When you consider the common condition among women, osteoporosis, weak and brittle bones, right? It's hard to imagine that would have anything to do with hearing loss. Yet there is a newly found connection between the two. And Taylor Parker from Concept by Iowa Hearing is here with this fascinating information that I have not heard yet, and I can't wait for you to tell me the news. First of all, is it fairly new news?
Yeah, within the last couple years, they've just found just more information.
Okay.
And when you think about our body, you know, I've been on here for, you know, a few years now talking about different health conditions that are all connected to hearing loss.
All related, because we're all, yeah.
We're all one.
Body,
and think about that with hearing as well. We're all one. You have three tiny little bones in your middle ear that are three of the smallest bones in your body. And when you think about health conditions, it never really starts in the largest. You know, when you have heart disease, things like that, it doesn't start in the largest vessels. It starts in the smallest and works its way up. Same thing with, you know, with bones. It's not going to start so much in the largest ones. It'll start in the smallest and kind of work its way through there. So three of the smallest bones we have in our body are in our middle ear that require movement. And if they, you know, become brittle and can't move like they need to, the correct signal doesn't get carried to the cochlea and then on to the brain where the brain processes that information.
It's the bones in the ear.
Yes.
See, and that's, my mother was very hard of hearing near the end of her life, and I could never figure out why. And you think of, exposed to loud noises and all that, but she had terrible osteoporosis.
Yes, and the study does show that more so in women, but some men can have it, but typically in women, just because we know with osteoporosis, that women that have osteoporosis are 40% higher to have a moderate or severe hearing loss. Not just mild, but moderate to severe hearing loss, 40% higher. So it's one of those things that if you've been diagnosed with osteoporosis or maybe even like, you know, pre-osteoporosis, that you should have your hearing checked, especially if you're over the age of 45 or 50. It's something you should probably, you know, should come in and have us check your hearing.
So hearing devices correct all of that, whatever your issue is with your hearing loss.
They can help with most conditions. There are a couple middle ear issues that, depending upon what that is, and our testing will show if we need to refer someone out to an ear, nose, and throat specialist for, you know, a middle ear issue. But, you know, typically hearing devices will help with most hearing losses, not quite all of them, but with most of them, yeah.
Including this hearing loss, it would be a result of osteoporosis.
Yeah, it'd be a bone conduction.
Bone conduction,
yes. They can help with that as well, but that could be a condition that we would at least refer to get, you know, a middle ear specialist to look at a couple things.
Have you seen that condition in men at all? Because we do think of osteoporosis being mainly a female condition.
And not that I know of, but, you know, I haven't seen all of our patients' information to know. But yeah, I mean, it's, you know, and they still don't know. And the funny thing is, they still don't know why it affects women more so than men.
About the bone loss.
Yeah, about with low bone density. It's just one of those things that they haven't pinpointed yet.
Right, the loss of calcium. For some reason. So, you know, we've connected a lot of things to hearing loss, haven't we? Here over the years, dementia is the one you like to talk about a lot, but this osteoporosis one seems newish. Yeah.
And you know, when it comes to health conditions, women tend to be more proactive. Men tend to be reactive. So when women hear about certain conditions that affect them more so, aspirin's another one that'll affect women more so than men. That if you're on an aspirin regimen of more than 4 days a week or more, it increases your risk of hearing loss by like 26%.
Is that right? Too much, specifically aspirin, not other kinds of pain relievers?
Not like baby aspirin, anything like that, but actual, like a regular, you know, regular size aspirin.
More than 4 a week?
4 times per week, yeah.
4 times per week?
Yeah.
Like for people who take aspirin on a regular basis for headaches or for other
you know, certain conditions,
relief. Yes, right.
And that, you know, there are over 200 over-the-counter or prescribed medications that can cause hearing loss. So there's a myriad of you know, over-the-counter and prescribed.
There's just there's no end to the things that can happen to the human body. What is that?
There is not, no.
It's true, yeah.
You know, the thing to remember is that it's all connected. And a lot of individuals still want to treat hearing loss as this thing that I'm going to put over here until later. When I'm older, I'll have to treat my hearing loss. And it's just one of those things that you can't wait. And because of the link to dementia and you know, cognitive decline, waiting is harming your brain, not your ears. See, and that's the key.
Let's just emphasize that just for a few seconds. Because if you have hearing loss that you don't treat, it really, it ages your brain and degenerates in your brain.
Yeah, they can show what they've shown on an MRI the difference between a normal brain and one that has an untreated hearing loss.
It shrinks.
Physically changes, and the issue with that is even when you treat your hearing loss, your brain doesn't go back to its original form. It's now in that current state.
The loss is the loss.
The loss is the loss.
That continues. All right, so this is all a good reason to get your hearing loss treated. Anyone you know, anyone in your family, someone you love, you know they're going through this issue. Concept by Iowa Hearing. Taylor, this is great info. I'm so glad you shared it. Thank you.
Always glad to be here.
Good seeing you.